Stephanie Paolini. I'm a neurologist with Prisma Health. So I grew up in Aiken, not too far from here, and went to college and medical school at USC. Went away for training in Pittsburgh for 6 years, and then eventually made my way back to Columbia. Neurology is a very diverse field. Neurologists can diagnose and treat problems with the brain, spinal cord, muscles, peripheral nerves, anything from headaches to seizures to strokes to dementia. So during my training, I became interested in women's health, specifically within neurology, and I spent 1 year learning about EEG and epilepsy, and then a subsequent year working in the Women's Hospital in Pittsburgh, studying how to treat chronic neurologic disease during pregnancy, which often requires specialized management. And then I also learned to recognize and treat acute neurologic disease that can occur during pregnancy. I have an obstetric neurology clinic, and I work really closely with primary care and with a lot of the OB practices in Columbia. And probably the two most common diagnoses I see in clinic during pregnancy would be headache during pregnancy and epilepsy during pregnancy. But I can treat a wide variety of issues during pregnancy. In medical school, I really became fascinated with neuronal networks, pathways, how the brain works. But I think putting that into practice, I saw an area of need in women's health, specifically within neurology, because a lot of neurology providers aren't necessarily comfortable with pregnancy and treating patients during pregnancy. So I find that very rewarding, and I think it helps a lot of people. I like to educate patients by counseling about a healthy lifestyle. So changing simple things on a day-to-day basis can really improve quality of life for a lot of patients with neurologic disease. My favorite example is something like drinking enough water or the right amount of water can help prevent headaches. So when I'm not working, I like to spend time with family and friends, and usually that involves cooking, baking, eating, some spending time outdoors as well. To make an appointment with me, please ask your primary care provider for a referral.